Well, I'm Dana Yarbrough. I live in Richmond, Virginia. It's me, my husband, John, and our daughter, Brooke Cheyenne Yarbrough, who is now in her late 20s. And we are, let's see, I work professionally in the disability field. So I get to kind of live, eat, breathe disability at home and at work. I work what's known as a University Center for Excellence in Developmental Disabilities, where I get to direct a lot of our work around family support, which can range anything from families with developmental disabilities, with special healthcare needs, any ages from newborns all the way up to aging people with disabilities and their family members. So we have a great team, and I've been able to network with a lot of families in my own state, in my county, in my community, as well as the state at the national levels, through some work with parent to parent and genetic centers and other work we get to do. So when I was probably approaching about 20 weeks gestation, so about 4 or 5 months pregnant, I was informed by the OBGYN that through some testing, they had determined that Brooke was at high risk of having Down syndrome. And so we went through some additional testing to see whether that was in fact going to be the case or not. They came back after the testing and said that that was not in fact probably true. And then 2 weeks later, I had an emergency cesarean, and Brooke was born at 28 weeks gestation, so about 12 weeks early, and ended up in the intensive care for most of the first 2 years of life. Because she was such a premature baby, weighed about 2 pounds, lungs weren't developed. There were other things happening. And at some point through her journey, with bleeds in the brain and some other things, Brooke ended up with quite a few healthcare issues and later diagnosed disabilities. And we're probably still not done yet. So, there are probably other things going on. Brooke has intellectual disabilities, physical disabilities, epilepsy and seizures, cortical blindness. It has a number of things happening. And so we're still always in the process of trying to get a good idea of where Brooke is, not so much because that's what defines and how Brooke is defined, but it is important to know as we're trying to make sure we're making really good decisions with Brooke, and that we know long term what life potentially could throw at her. So I think we're probably, because Brooke doesn't use words to communicate and has fairly significant intellectual disabilities and visual impairment, it's really difficult for a lot of the testing and a lot of assessments to be done with Brooke. And so it is probably something I just, again, foresee that will always be something we'll be looking at, and never kind of knowing exactly who Brooke is and what all of her diagnoses are. Ways that families can get involved in some of the systems change, this idea of nothing about us without us, don't develop systems without that end user being there at the table. And it's not about creating one more seat at the table for a family member, but actually giving up one of your seats so that families can be there from the start. I think for me, my journey started with, when my daughter was receiving early intervention services, they were required to have families on their advisory board for the early intervention program. And so they were always seeking parents, and I decided to try it out. So when Brooke was just about 18 months old, 2 years old, I joined this committee, and there was a lot of talk about budgets and things that I didn't know what they were talking about. And so it turned out it really wasn't my thing. And so I heard about something called Partners in Policymaking, and most states have a training called Partners in Policymaking that sometimes is run by their state developmental disability council. And I signed up for the training and was one of the parents selected when Brooke was just a few years old. And that 9-month experience really did open up all of the systems from birth probably to the grave. And so it gave me a broader appreciation of not only where Brooke was now, but what was ahead of us with education, with post-secondary education, with living and housing and work. and all kinds of things that I was nowhere near ready to be thinking about when she was 2 years old, with hundreds of medical appointments going on each year and therapy appointments. And so it was overwhelming, but at the same time, I met a lot of people that worked in state agencies through that training and got to hear a little bit more about their vision for how services should look, whether that's how they were implemented at the in the county or city. It's a different answer, is a kind of a different thing, but how they envisioned it working, what the laws were supposed to do. And I was really interested in that conversation, not always about how the program's budget was being spent. And so that's a type of systems change of where are the values and the vision of the leadership in those systems, and how do you keep your energy up as a family member to keep coming to the table when that leadership changes. And in some states like Virginia, we can only have a governor run one term. So you have governor changes every 4 years. And that means all of your state agency leadership changes every 3 to 4 years, because they're coming and going with that administration, which could be Republican one time and Democrat the next. And so it seems like it's a never ending hamster wheel that you're on, because you feel like you're gaining ground, and then suddenly everything changes and new leadership has new priorities. And so then you almost have to start over. So if you're going to get into this work, there are various ways to come in. One is to be at the table of those advisory boards and sitting there. Another is to just go and I would say you have to kind of continue your energy and momentum to be at the table. And you have to remind people that you're not one parent speaking for everybody, but that you have a unique experience. And then another way to come in is to really work with your state elected officials and just keep telling your family story and showing up at every hearing at your state capitol. I tried that for a little while. And again, the way government works is you wouldn't get the notice that there was a hearing until a day before, and then you're scrambling with childcare, with trying to see how you can get down there with your work schedules. And so I found that to be really chaotic. And so it, for me personally, wasn't the avenue I wanted to go. So I kind of prefer now to be at some of those state level committees, but each person has to figure out where their tolerance is, where their energy levels are. But you can give back in several ways and be a part of systems change, even if it is sharing your family story or answering surveys that are sent out by agencies about what they should be focusing on in their next year or two. One of the probably the biggest challenge that I have to always remind myself when I'm sitting at a table with a group of people, and it's not at the education table or early intervention table about Brooke. I'm now thinking about all the Brooks, and I have to kind of dance. I call it the balcony and the dance floor. And I have to think about when I'm on the dance floor, I am focused on Brooke and the people around me, that we're all dancing the same dance to the same music. When I'm up on the balcony, I have to put myself to look out over everything. And that requires, some people can naturally do it. I do think it helps to have training to be able to do that. And part of that training is, how do you take the good, the bad, and the ugly experiences and find a way to get that message across that doesn't turn people off. And that's really hard, because I'm so emotionally connected to Brooke, and I'm emotionally connected to other Brooks out there because of the other families I meet, and I hear similar stories. If I come in and have things to offer as solutions, they're willing to listen. And I have to find out how to harness that energy and that frustration so it doesn't come across in a way that turns them off, even though it's legitimate issues with what's working and not working. Their first reaction, often I have witnessed, is that sometimes professionals around the table will say, that's just one more family complaining, and I want them to hear me. So I have to sometimes not lay down and have people walk over me, but find that humility, find that way to really compassion. What are ways that I can be candid in what I'm saying, but do it in an empathetic or compassionate manner that gets them, it grabs them at the heart and grabs their head. So they're hearing it both and feeling it. Otherwise, I have been in a room where I or others, I can see we've lost the professionals as soon as we start going down the road of what's not working. And so anything I'm going to say that isn't working when I'm at a table, I'm always going to come up with at least one idea for a solution, and try to offer something. So I'm not just coming in and saying, this doesn't work, that doesn't work. What I try to say is, wouldn't it be great if we could think about a way to do something that makes it work? And I did a little bit of research, and here's something I found in another state, or here's something I found in our state. Could you tell me more about how this could work with this system? And so just kind of doing a little bit of homework also at the same time. But really, I think compassion and empathy and humility go a long way in that relationship building at that table, because we're unfortunately probably not all going to get what we all want when we're at the table. We know that there are funding issues, there are political issues, there are constraints because of rules and regulations. How something is set at a state and federal level isn't what it looks like when it gets to the neighborhood level. So there's always going to be something that is just not working well, and we need to celebrate what is and then find a way to work together as human beings at the end of the day at the table. I guess some advice I would share is, I am a big believer in approaching people with some humility and empathy. We never know what's happening in a person's life. It could be the worst day of their life and we don't know why. And we're just suddenly in an interaction with them, and something could be said, or a body kind of the way someone's communicating with body language. And so how do we not get too caught up in that? So if we always come in with this way of working with others, with throwing down some little piece of who we are, that opens up this door to humility and empathy and compassion, so we can let some other things go that are happening around us, the noise, and cancel some of that out and just focus on having a really rich conversation. So I would say that would be one thing, is that you just never know what's happening in a person's life or people's around you. So don't always take what's said that is being completely rude and disrespectful if it feels that way. I also would say that, you got to watch your energy levels. There's a lot of energy we can devote to being angry all the time with what's not working. And we can get really frustrated when we're on the phone all day because another insurance denial has come through, or we're waiting 35 minutes to get an appointment. And then we have to go sit at the doctor's office for 45 minutes in the wait room before we even get into the office, and we're sitting another 20 minutes while we're waiting on that cold table for a doctor to come in, and we can quickly lose our patience. And so there's a lot of energy required. So be thinking about the self-care piece, which we don't do well as parents, particularly mothers. We tend to say we can do it all. And the long haul, that's a heavy load. And we can begin to really burn ourselves out to where there's not much left in our well. And so be thinking about ways to replenish energy, and finding whether it's a 5-minute break or a 30-minute break every day to do something just to get that energy back up, because we need to be at the table. We need our voices heard. We need systems to hear what isn't working and what is working, and innovative ways to solve problems. And we as parents can be really savvy at how to do that. We do it every day in our homes. We find little life hacks that make life a little bit easier for us when we're working with our child or children. And we have just great innovative ideas that can be brought to the table. They may not always work at a state level, but we certainly have the right to be there and share those. And so, and we can't do that if we are completely depleted, and we're frustrated, we have no energy, and we just have no real brain power to be sitting at the table, because we are, again, just flushed out. And so I think for me, that's what I've learned over the last 2 decades, is trying to do it all and then burning myself out at the end of the day and not being good to anybody. I would add that, when I started off with Brooke, it was really important that Brooke hear all of her diagnoses. So I'm a parent and my daughter has these diagnoses. And as I got moving along, what I really wanted to talk about was Brooke's gifts and talents. And those were not her diagnoses. They were the things that made Brooke the fun little person that she is, and the one that makes me happy every day when we have little dance parties or whatever we're doing for a 10-minute break in the afternoon. And I think as parents, we sometimes can get caught in that cycle of needing to talk medical jargon when we're at the medical table, or needing to talk in a different way when we're at a education table. And we can just be plain. Let's just talk about our kids in plain language. And so I would just, remind myself and others to really think about plain language, talking about our children, and really talk about their gifts and talents.